Just because you're on Medicaid, Medicare, don't mean that you're not a human being. We still need medicine, and it needs to be cheaper. People like me, I worked all my life. Why do I have to pay out of my pocket so much for medicine that I need? Okay, Duchess, we're on our way. Pick up Avery. My name is Diane Dixon. Everybody calls me either Miss D or BB. I was a jewelry manager at Kmart, and I turned around to go into my jewelry counter, and as I was walking in, I went totally legally blind. And everybody, I'm a jokester, so everybody thought I was joking. And I couldn't see, and I fell over the boxes. And I kept on saying, I'm blind, I can't see anything. You got homework?
Science and math.
When I got to the hospital, the doctor looked at me and he said, you have multiple sclerosis. And that was it. That's when I found out, and that's how I found out.
She called me and she was like, hey, finally figured out what was going on with me. I was like, well, what was going on with you? She goes, I have MS. Well, what the heck is this MS stuff? She goes, I don't know. They gave me a bunch of pamphlets. We're going to have, I need you to look up and help me figure it out.
The earliest I can remember was when I was 6 years old. She could barely get up the steps, so I literally had to pull her up to get up the steps and help her to her room.
I have muscle spasms real bad where my hands and my feet will just clam up and I can't move them. And then fatigue is the worst thing ever because I'm a runner. I didn't sit still. I have to sit still now. I have to lay down because if not, I'll fall.
Thank you, Mom.
It was hard as sin when I switched from private to Medicare. It was a nightmare. The cost of medication is ridiculous. If I didn't have insurance, I would pay $1,000 a month. I can't afford to pay $1,000 a month for anything. If I didn't have financial assistance, I would be on no medication whatsoever. I would not be on anything. I would just have to live with the disease and pray that I don't get any more new lesions. Give us, Lord, our daily bread. I could not get medicine for the first 3 months of this year. It was stressful because I couldn't afford it because I didn't get foundation early enough.
I just want to keep her around as long as I can. I want to become an inventor and try to invent like cyborg bodies so I can give the first one to her.
You have to have a good team in order to get through MS or whatever kind of disease that you have. A good team makes it much easier for you. We go to Congress once a year to tell them about MS and we help fight. Make medicine affordable. If you had a disease and you couldn't get your medication, how would you feel? You had to make a choice, but paying the gas bill, electric bill, or whatever else you have to pay. How would you feel? How about if it's your mother or your father? Maybe it's your child. The disease does not make you less than a person. It gives you power because you have power over that disease. I don't say I have MS. I have something that makes me sit down and wait, but MS don't have me.
In the beginning, I had relapsing remitting MS. Now it's primary progressive MS. It's not something you could sleep off. The next day you wake up, it's still there. It's comparable to a house where the plumbing would stop working. The lights blink and everything's crooked. The yard would be very overgrown. Things aren't working as they should. My 3-year-old granddaughter thinks she's my caretaker. She says, "Here, Grandpa, I'll walk with you." She walks a little too fast sometimes, but we get there. The MS Society's been very crucial in my life. Through them, I met people with it. That makes a difference. If my grandkids never have to go through this, that would be a godsend. And people would be saying, "Hey, remember MS? You know what that is?" They Google it. I have MS. MS doesn't have me.
My name is Anne Marie, and I was diagnosed with MS on New Year's Eve 2002. When I was first diagnosed with MS, what started as a normal day quickly turned into something else. While I was at work, I was having difficulties holding and grasping a pen, and really didn't think much of it. Decided, I'm just going to go home and make myself a cup of tea and everything's going to be okay. But it wasn't. I woke up that next morning and I had total numbness from the waist down, and I couldn't use my hands. I couldn't hold a cup, couldn't brush my teeth, couldn't comb my hair. But more importantly, I was scared to death. MS affects you at the prime of your life. I had just started a new career after years of education. I'm in the workforce now, and all of that changed. When I was first diagnosed, there weren't that many options, I guess you can say, for people of color. There wasn't that much in terms of PR. Often if I picked up an article that talked about MS, it wasn't featuring a Black person. Very far and few in between did I ever see anybody of color being talked about regarding their journey. So fast forward to today, 10 years later, now I have a Black Experience Summit that was nationwide. There was people from even outside of the United States that partaked in that. With one woman actually saying, I wish we had something like this where I'm at. That's the kind of reach we need. That's why we do what we do. What we do matters. I would have never thought that writing a letter to an organization just asking, where are people that look like me, would turn in today as someone who's been on Capitol Hill and spoke right next to House Majority Leader Schumer. Who would have thought I would be publishing newspaper articles from the New York Times to WebMD? Who would have thought that that girl from Brooklyn who's poor would be able to reach so many? Keep doing what you're doing, because believe me, you're helping many. Thank you.
I am fearless, I'm driven, I'm passionate. It's a little ironic that my MS is as aggressive as I am. I struggle with tremors, double vision, brain fog, and chronic pain. It's this stabbing feeling of these jagged edges just coursing through your entire body. One morning, I woke up, tried to move my leg, it wouldn't move. My thoughts were, is this going to be for the rest of my life? That the inevitable was finally happening to me. And then my legs started to tingle. I'd never been more grateful to be in pain again. I'm so hard on myself and my new normal. We just have to remind ourselves that we are warriors. When you hear about a cure, it brings that hope back. If no one would have to ever experience this, it would just change the world.
What's going on, everybody? Listen, y'all caught me in my groove. The music is hitting today, all right? We are so incredibly thrilled and so excited to welcome y'all into the third, count them three, right? This is history. The third annual Black MS Experience Summit, man. Y'all get some hand claps going in the chat. Y'all get some fire emojis going in the chat, right? My name is Tyler Campbell, right? And I'm an inspirational speaker. And my story is I was the first person to ever play Division I college football with MS while I was at San Diego State. I was diagnosed in 2007, and I have been sharing my story ever since, which is my encouragement to anybody is to share your story and get it out there, right? But more importantly, I'm glad to be back co-hosting this amazing event for the second year in a row with my illustrious, the amazing, the beautiful, the intelligent Michelle. Michelle, how are you doing? Come on in. Let the people see your face, dear. Let the people see your face.
I need to take you like everywhere I go. Like you're just going to introduce me on all future calls moving forward. So, hey, Tyler, it's so great to be back with you. We have an informative couple of days planned, and we, as you can tell, we are so excited. I know the producers behind the scene are like, keep it down a little bit. But I'm Michelle Witherspoon. Hello, everyone. I am a longtime volunteer of the National MS Society and a member of the National Board of Directors. I'm also the Chief of Culture, People and Operations for our Security and Trust organization at a company called Cisco Systems, the backbone of the internet. And I've been living with MS since 2003. And Tyler and I are here today to really bring some energy to everything that's coming next. Tyler, what we got coming up?
Listen, y'all, did y'all hear? We got to take a breath for Michelle's resume. She being polite. I know y'all, listen, my intro, Michelle, was short and sweet. Yeah, you had a little resume going in there. You know what I mean? Listen, for everybody out there who is watching, listen, take a moment to introduce yourself, all right? Communication and engagement and relationships are everything. So take a moment to really introduce yourself in the chat, okay? Share your name, where you're from. This program can have the opportunity for you to connect with somebody who's right down the street from you and you didn't even know it. When we talk about community, when we talk about, having a team, you could by chance be building or adding to your team right now. Connect with other attendees and connect with the society staff. You can also ask questions there. If you're having any issues, put them out there. Another quick logistical note, right? Closed captioning will automatically appear in a box below where you're seeing our beautiful and handsome faces, all right? So closed captioning is available. And Michelle, I don't know about you, but for me, when our people gather and seeing everybody engage in community from across the country to connect and talk about the common experience of being Black with MS, oh man, it gets me excited. And our topic today is one that is so critical to address to make sure, right, that we get what we need to manage our multiple sclerosis. It's about us today, baby.
Yeah, it's so true, Tyler. Managing MS can sometimes feel like a full-time job. Even in the video, she was like, it's our new normal. We all have to learn how to live with it. And so we know all too well that being Black with MS carries so many unique challenges and experience, not the least of which is navigating the healthcare system. You heard those stories in the opening videos. We've heard from so many of you the feedback and the stories of how you operate and live in this Black MS community, about the struggles and the experiences that all of you have, from delays to getting your MS diagnosis, many of us in the first place, to not being listened to by the medical professionals. It's clear that getting the healthcare we need can sometimes be much harder than it even needs to be, Tyler.
Hey, we got to talk about it, man. Our perspective, you got to shine light on it because it's different than others. That's why this is so imperative. It's our voice, right, Michelle? You know what I mean? Right. And when something that is already so hard is made even harder. You feel me? When it's already difficult, now it's even harder. It can really get you frustrated and it can make you so demoralized. Yo, put something in the chat if y'all feel where I'm coming from, if you've ever been there. I know I have. I know many of you all have too. That's why the focus of this year's Black MS Experience Summit is on empowerment in healthcare. We got to take some power back, and our stories are powerful. They always have been, and it can be both validating and enlightening to hear from people like us, people who look like you, what they're going through, and how we share similar experiences. We're not that different. So that's what we'll spend these 2 days doing together, hearing our stories, all right, from our community and sharing the solutions we've come up with together as we navigate life with MS. Our stories matter, Michelle. They always have.
So much. I mean, look, Tyler and I have so much energy because we know it's going to be a powerful and empowering couple of days together. So we hope that we can all come away from this experience energized, more hopeful, with practical tips, or maybe 2 or 3 that we can put into action to make sure that we're getting the healthcare that we need and also that we deserve. Right, Tyler? Right. So here's the thing. You know, we always got to do a little shout outs. So before we get started, we're going to thank some of our generous organization that have helped make this summit possible. And this year, I'm going to let Tyler do it because last year I kept messing up the names. Okay, so Tyler, it's on you this year.
Oh, look. You see how y'all passing the baton. She passing the baton. Like with no pressure. Michelle, I didn't even think I did you that. I don't even think I gave that intro of pressure before you took it. All right, so here we go. Fellas, I'm going to represent. Here we go, fellas. Here we go. So I want to say thank you so very much to our premier contributor, EMD Serrano. Hats off to you. We thank you. We thank you to our esteemed contributors, Genentech, Biogen, Janssen, and we want to thank a special thank you to our contributor, Santos. Mic drop, Michelle.
You did it. You did it. And you can own that always moving forward. You will handle contributors. We want to thank, look at you. All right, here we go. Thanks for all our contributors for their support. Be sure to show them some love though in the contributor booth icon. It's at the bottom of your screen right after you get off this session. Like, pay attention to us right now, but when you finish your session, go to the bottom of the screen and go to the contributor booth. There's so much information out there.
Yes, we thank them for that. Y'all, please do that. Thank you for reiterating that, Michelle. Very important. All right. Now let's get to it. I know y'all been waiting on it. All right. So first up, we have Ayana, and she's here to share her experience of being diagnosed with MS and how her perspective has changed throughout her journey. Come on, Queen. Let's go, Ayana.
Hi, my name is Ayana Rivers, and I was diagnosed in 2001 while I was a graduate student at TNEC at Fairleigh Dickinson University in Teaneck, New Jersey. So essentially my diagnosis, my acknowledgement of my symptoms kind of came into like a left side paralysis where it was numb and I felt like I was dragging my body, so to speak. So I took myself to the ER where a doctor told me he ruled out a heart attack, and he essentially said, you either have a stroke or you have multiple sclerosis. Whatever the case is, come back. And so that was sort of my introduction. Over the course of time, so I was diagnosed when I was 26 and I'm 49 now. It's been a journey of self-realization and actualization. I've been through a lot of different medications, from injectables to orals, and now I'm on an intravenous medication. But regardless of the medications that I've chosen or been selected for me, I've always kept a couple of things sort of front and center. One is eliminating stress and stressful situations and stressful people. And really trying to kind of minimize the stress, outside stressors that can impact my life and can impact my disease and how I manage it. The other one was in terms of how I eat and how I manage those things too, from a dietary perspective. So I've gone from the spectrum of being a vegan to now eating a little bit of everything, but being very mindful. What I would also say is one of the things that have been successful for me is exercise. So that's been a hallmark of my existence for the past 10 years. Whatever it was, whether it was yoga or Pilates or the Y or weight training, I got really creative in terms of the things I enjoyed. And that helped to keep down all those other things too, like the stress that can kind of creep up. I one of the things I would want to pass on to anyone who was recently diagnosed with multiple sclerosis is a positive attitude, and embracing sometimes the flexibility of adversity, and kind of attempting to kind of embrace those things as much as possible has really helped me, and I hope it helps you too. Thank you so much again for welcoming me into your homes, and have a great night or great day, so to speak.
Hey, I told y'all we are coming in hot right off the bat. All right. That was such a great example of how being flexible in the faces of our challenges, right, can make living with MS just a little bit easier. And I'm telling y'all, get your pen and paper ready, because you're going to want to take some notes. Knowledge isn't always power. It's applied knowledge that's power. And there's a lot of knowledge that's given, but you got to have pen and paper to be able to remind you to apply it. And as we talked about earlier, when you're living with MS as a Black person, right, adversity can sometimes feel like it's every corner, every direction that you look, especially like we talked about earlier when it comes to our healthcare. And that's why I'm pleased to introduce the National MS Society's president and CEO, the El Capitan, Cindy Zagiboilo, and Vice President of Diversity and Equity and Inclusion, Nisha Fredericks, to talk a little bit more about the inequities our community faces when it comes to just getting healthcare and getting the support that we need. So Cindy and Nisha, take it away.
Welcome to the third annual Black MS Experience Summit. It is great to be with you. While more treatments and solutions are available to people with MS than ever before, we know that stark inequities in our healthcare system keep many Black people from receiving the level of care, information, and support that they need. This has to change. We know that systemic racism can affect every aspect of the healthcare experience for people of color. And specifically for people with MS in the Black community, we know they are more likely to receive care in the emergency department, more likely to have hospital stays, and more likely to have higher medical bills. And they are less likely to see an outpatient neurologist. This has to change. The existence of these disparities is not speculation, it is fact, it's real. The evidence, which continues to mount, is clear. And the stories of people's real life experiences are powerful and heartbreaking. This has to change.
That's right, Cindy. And we know that getting the diagnosis in the first place can be especially challenging. All too often, Black people leave the doctor's office feeling dismissed, questioned, and have had a troubling symptom ignored. A healthcare setting should be a safe and helpful space, but we know that both implicit and explicit bias can make it feel unwelcoming and even scary. And for far too long, MS was considered to be a white person's disease. Structural racism, healthcare inequities, and a lack of representation in clinical research have had a profound effect in driving misconceptions about the prevalence of MS on historically underserved and underrepresented populations. Black people with MS, including those who haven't been diagnosed yet, still endure the consequences of that long-held mistruth. We know the story of Antoinette, who provided doctors with spreadsheets of symptoms and test results, which included actual evidence of lesions. One doctor said there was probably nothing wrong. Another ruled out MS entirely. Instead, doctors repeatedly asked her about HIV, lupus, and sickle cell anemia. This can be a demoralizing experience that can push an individual further away from the care and diagnosis they need. and disempowering for them as their own self-advocate. Something we hear often from people in our community is, I didn't even know people like me got MS, or I didn't see anyone like me. And it's not surprising. Black people were largely unseen in the world of MS for generations.
That's right. Yes, this is the problematic mistruth about Black people and MS lived on for a very long time. And while we're working to correct the misinformation, it persists today. For generations, Black people have been underdiagnosed and underrepresented. And I'm sorry to say that the belief that Black people are less likely to get MS is one that our own organization, the National MS Society, helped to perpetuate. This is something we have to own. It's something we have to work every day to make right. In order to look forward, we've had to look backward. We've had to reflect and dig deep, to embrace and understand all the ways we were wrong yesterday so that we can be right today, tomorrow, and moving forward. So we can always be getting better. Today, we're focused on using our knowledge and influence to correct that dangerous false narrative. And we are addressing the serious inequities in the healthcare system. It's a big problem to solve.
It is indeed, which is why we're going to tackle it in many different ways. One area we're focused on is increasing diversity in clinical trials. In fact, the Society recently rallied corporate healthcare partners to declare a shared commitment to health equity in clinical trials and data collection. Cindy and I will be back shortly to talk more about the Society's plan. But first, here's one person's story about why participating in a clinical trial was important to them.
Hello, everyone. My name is Yvette Briscoe, and I wanted to talk to you a little bit about clinical trials today. I participated in a clinical trial. I'm actually just finishing that up right now. And it was an interesting experience. We had a little bit of a rocky start at the very beginning, but I'm so glad that I was able to do it because it gave me a little bit of insight into how things work. It gave me access to the disease-modifying therapy drug that I'm on, with them paying for it so that they could get feedback. And it was very fulfilling knowing that I was able to participate and to contribute to what is being learned about Black people and how MS works for them and how certain drugs work for them and that sort of thing. So something that affects us. I enjoyed that part of it. When you participate in a clinical trial, the information that is being gathered, regardless of which phase of the trial you participate in, it's very important to advancing the knowledge for Black people living with MS, right? We are not the same. We have differences, and in order for those differences to be appreciated, and in order for treatments and hopefully one day a cure to be found that works for us, they have to have information about us. And participating in a clinical trial, while I know that there is some hesitancy sometimes, there are things that we remember, even if we weren't alive when they happened. Tuskegee, Henrietta Lacks, things like that will kind of trigger a caution for us sometimes. But there are ways to participate that are not as invasive and maybe not as scary, something that you can get comfortable with until you're ready to participate in the bigger trials. So completing a survey. That's something to get started with and can lead to something bigger. You could participate in the MS genetics group where you just make a blood donation and they're not putting anything into your body. You're just giving a little piece of you that they're able to analyze and use that to get more information about us as a group, as a whole. And then you can progress. Starting out with a phase 4 clinical trial where the drug has already been out on the market and they're just getting more information about how it works with individuals in different classes. So if that's something that you're interested in, if that's something that you feel like you want to contribute to, helping to have a greater understanding of how MS affects us, those are ways that you could do so.
Come through, come through. Listen, Yvette got me hippo happy, giraffe giddy, and peacock proud. Man, thank you so very much. Hey, you know that? I just feeling it. This is a subject, and I know, listen, I'm gonna get out the way because I know Michelle's very passionate about this, but I'll thank Yvette for sharing all that information because it was much needed and it was so necessary, so important for us to participate in clinical trials. I've done it personally for a DMT I'm currently on. All right. So holding myself accountable for it first. I know you have done several though. Michelle, talk to us about it. Talk to us.
Yeah, it's something that's deep down in my soul. I want more people to stand up and participate in our community. I have MS. My sister has MS. My aunt has MS. I've participated in several trials. Some are easy, like Yvette said, where you give a blood sample or you get interviewed through a survey. Others are more genetic data, like the one that my aunt, my sister, and I all participated in. They just wanted to know about our family, right? And Black people do get MS. And just kudos to Cindy, Tyler, and Nisha and all that they've done. The last one I participated in was a double-blind study where I got paid. Right. But why is it important to really participate? Yeah, let's talk about a little bit why. We need this perspective of fairness. When we as Black people don't participate, we don't diversify the participants in the clinical trials so that they can get a better understanding of the science. So when we do that, it reduces the health disparities in medicine. And right now, let's keep it real. Only about 2% of African-American Blacks participate in clinical trials.
Whoa, Michelle.
Population.
One more time. Can you say that one more time? Say that one more time. Say that 2%. Say that one more time.
Yes, this only 2%. And we know that there's a lot of reasons why. But we are where we are now today. So when we participate, now we give people the data to support the drug efficacies in our population. Why, Tyler? Because it matters. It matters. We want the medical community to document the differences between our MS progression and the disease compared to other groups. And when we don't participate, there's no data there. So we know there's barriers to participating in the healthcare trials. We know that. We know there's lack of awareness about the trials. We know sometimes you have to go somewhere to get there. So it's lack of transportation. We know sometimes when you participate, you got kids, you ain't got nobody to take care of your kids. So there's lack of childcare. And then as we talked about, there's this lack of mistrust. But here's where we are now. When we participate, we can make a difference. And so to learn more about ways to participate in the research and other ways to get involved, Tyler and I'm going to tell you again, go to the resource room. It's at the bottom of your screen, not now, but once we finish talking, and click the Understanding Clinical Trials and Studies screen, right? There's also going to be a breakout session later today. We're going to highlight that in just a second so you can learn more about it. I mean, Tyler and I always have discussions around this. We are both so passionate about this.
Hey, I appreciate you for sharing your heart and giving us a window seat into your own personal family, Michelle. And it's real because we need to be a part of the discussion. So thank you. We not only need to be present, but we need to make our presence felt. And it's a difference. Right. And as we know, increasing that diversity in clinical trials is just one, right? It's just one of the many ways to address inequities, but it is a way. And in the healthcare system for our community, we have to get involved, Michelle.
That's right. And Cindy and Nisha have done such a great job. I mean, just for Cindy to say, look, there was a false narrative out there and the society is working on that. Let's now welcome back Cindy and Nisha to talk more about the amazing work that this society is doing to address these issues. Over to Cindy and Nisha.
Thank you, Michelle. And now Nisha and I are back to tell you a little bit about what we are doing to address inequities in care and to advance diversity, equity, and inclusion in everything we do. so that we can be here for every single person with MS. At the Society, we continue to intensify our efforts. We've worked to build a solid foundation, weaving DEI into all of our work and pulling together disparate efforts across the organization into one view. And we've been making important progress. This summit is one example of that. And we hired Nisha, our Vice President of Diversity, Equity, and Inclusion, to lead a thoughtful, connected strategy and keep the conversation front and center across all of our work, and to lead us in holding ourselves accountable individually and collectively to the goals we've set out to achieve. We're investing in research to better understand how MS affects underrepresented groups, like funding we provided to study immune cell differences in racially and ethnically diverse people. When we can better understand why MS affects Black people differently than white people, we can help healthcare practitioners create more effective treatment plans. And we're making sure the issue of health equity is considered throughout all our advocacy work. And we're mobilizing our powerful base of activists nationwide to advance policies aimed at eliminating health disparities.
Absolutely. And as Cindy and I discussed earlier, using our influence to make the healthcare setting equitable for all is critical. That's why we're focused on expanding and diversifying the MS clinical workforce by increasing our clinical fellowship program. We are removing barriers that prevent clinicians that represent the full spectrum of diversity from getting into the field. The opportunity to work with a healthcare practitioner that has a shared lived experience can make a big difference in the quality of a person's MS healthcare. And it's vital that every single person can see themselves in this movement. No one should ever have to ask the question, why don't I see anyone like me? Representation matters. So we're working to incorporate more voices, more perspectives, and more lived experiences throughout all of our content. Every person affected by this disease matters, and everyone should feel seen when they connect with their National MS Society. And as I say often, this is a journey. We aren't merely checking a box, and we aren't striving for perfection. To be successful is to live in a growth mindset, to put in the work and always be learning and growing. And we have to do that together, which is why all of you have a critical role in this work. We want to hear from you. And being here at this summit is a great step to co-creating with us along this journey. I hope that each of you gains something truly valuable throughout our time together, whether that's learning something new, making new connections, or feeling supported, inspired, and seen. And lastly, throughout the summit, we're going to tackle a lot of big and weighty topics, some that may be painful to think about and talk about. So let's remember this. We are all in this together, and we're here to support one another. Let's be mindful of what each of us needs as we move through these important conversations. And let's take care of ourselves and each other. Now, Nick is going to share his story of one way he's taking care of his needs as he navigates his life with MS.
Hi, my name is Nick Powell, and I was diagnosed with multiple sclerosis in September of 2019. You know, after receiving such shocking and devastating news, I immediately fell into a dark and deep state of depression. At times, I found myself not wanting to wake up, not wanting to go to work, not enjoying the things that I used to, and I didn't even want to play with my newborn son. I didn't want to face reality knowing that I was now living with MS. I quickly realized that I needed some help. I reached out to my doctor and asked for a referral to see a mental health therapist. With a little bit of encouragement, my doctor stated that, things will definitely turn around after you seek some outside perspective. And I can honestly say this is probably one of the best decisions I've made on my journey to date. There's a lot of stigma that comes along with mental health counseling, but when you're dealing with life changing events, sometimes you'll need an outside person other than family or friends to lean on. It's always great to have someone on your journey that can offer you not only encouragement, but they can also give you an outside perspective. Remember, we're all in this thing together, and you're never alone.
Thank you so much, Nick, for sharing your story. I mean, just Cindy and Nisha, everything's been so powerful. Representation matters, having a growth mindset, even hiring Nisha to this society makes a difference. But we really want to say, yeah, just everything. We're just so glad that all of you are here and that, Nick, you were able to get the help that you needed. Tyler, let's talk a little bit about mental health.
Yeah. Number one, hey, it's real. Okay, it's in the real.
Yes, that part.
It's definitely not a figment of the imagination for our community. This is real. All right, taking care of our mental health is incredibly important. That's why, Michelle, I'm really glad we are taking the time to talk about this so we can get past the stigma that can sometimes exist around it. Hey, I see a therapist every Sunday, 3:30 p.m. And I'm not just saying that as somebody who doesn't do it for themselves. And I gotta have somebody who's stern with me, Michelle, because I'm stubborn. Okay, so me and him, we kind of go at it, but he gets me right. You know what I'm saying?
Yeah, and we've talked about this. I mean, I hugely compliment Tyler as a Black male, saying, "Hey, I go to therapy." And I want to talk to someone. I also go, we talked about this. I was diagnosed with depression and had major anxiety attacks. And so going to talk to someone and for a minute, even getting on some medication was extremely helpful. And we see so much going on in the chat where people are agreeing with this and saying, this has helped me too. One of the other things that we just said in the last video segment was was having a growth mindset. So every morning, Tyler and I talk about, we go see every week we go see our therapist. Every morning I get up and meditate, or we try to take walks. I mean, you got to take care of your full self. Okay, so Tyler,
it's a lot.
It's almost time to wrap up. Oh my gosh, it's time to go to the next thing. So before we wrap up, we want to share with you a few things that we're going to check out in the Summit environment, because we want to make sure you get the most out of this experience. We were telling the producers earlier, they did such an amazing job with the platform. We made it easier to navigate, but we don't want to make sure you miss anything. So make sure you check out the Connection Lounge, where you can get involved in the Society's Black MS initiatives. You can get guided meditation that Tyler and I just talked about. There's wellness information out there. You can connect with others. I see Lisa Ripley in the chat, who's one of our advisors on this committee, talking to everybody. Where are you from? Where are you from? So you can connect with everyone in the chat or on video. We want to make sure you get the most out of this experience.
Man, take it all in. All right. Every resource, utilize it. Take all of this in. All right. And don't just keep it to yourself, share it with others. Another great way to connect is by using the matchmaking icon on the navigation bar. All right. This is how you find people similar interests. All right. And who may be close, like I talked about earlier, who may be geographically close to you. You may see somebody, they live right down the street from you. Been there the whole time. Y'all never even had a conversation, been waving at each other, pushing your trash can down to the street. That same person. All right. You can also check out the speaker hall. All right. This is how you get to know the expert presenters. You can see and learn how Michelle presses that hair. I'm just playing, Michelle. I'm just playing. All right. I learned about our expert.
Trying to look presentable for you. It's hard to go up against you.
Hey, take me to the barbershop, taper fade. I'm good. I'm good to go. I know the fellas, the ladies got to work a lot harder than we do. All right. You give them credit when it's due. Okay. Get to know the presenters, all the breakout sessions for everybody who's leading. Michelle, you in there. We talked about it.
Yeah, so Tyler, that's right. Okay, so come check all of that out that Tyler and I've talked about. We also want you to go visit the resource room so you can get links to all the brochures and websites. The whole goal of this is that you just don't listen right now, get off and start doing something else, but you continue to learn, download the information, use the My Favorites tool to save anything that you have like a particular interest about. That way you can go back to it and find it later. Like, use the whole platform for your benefit.
Ah, that's it. She said it. Use the whole thing. And the content hub on the navigation bar. All right. That's how it will help you find resources similar to other topics you searched and are interested in. All right. So it's doing things that are catered to you. So please check that out too.
Yeah, so thanks, Tyler. So helpful. So we love all the ways that you can find out what you need and save it. Right? We just want to reiterate that. We know we're saying it a lot, but we're reiterating it. Also, if you're competitive, like me.
Like she.
Yeah,
Michelle been watching this.
Already before it started, I'm like, oh, I'm in the top 10 on the leaderboard, right? I don't know where I am now, but if you're competitive, check out the leaderboard so you can earn points. That's based off your program session views, the rooms that you enter, your chat conversations, and so much more. When I left before we started, I think I was like number 5. I don't know where I am now, but get in there and show us your participation.
Participate, y'all, because Michelle coming for a W. She wants number 1. So y'all don't let her walk away with that easy. All right. So this is important too. If you're having issues navigating the environment, if there's any tech issues, whatever you're having, visit the help desk to chat with someone that can help you. Don't just bail. Go to the help desk. There are people here who are able to help you. And I'm looking forward to checking out all that the summit has to offer this year. How about you, my dear?
Yeah, me too. I'm really excited. Okay, so let's tell you what's coming up next, because you're probably tired of hearing me and Tyler right now. So next up, we're going to tell you about the breakout sessions. Okay, so you'll be joining the breakout sessions, and Tyler and I are going to slow down on this part because there was some confusion last year. So we want to make sure you understand that. So you'll be joining the breakouts from the program session room, which you can locate on the navigation bar at the bottom of the screen. The breakout sessions are a really safe and interactive way where you can learn from experts. You can talk about your experience of being Black living with MS. You can ask questions, and also it's a great way that you can build connections. Okay, so let me tell you what our topics are for today. The topics are today, MS in the Black community. That's a great title. Understanding clinical trials and studies. You know, that's one of my favorites. Also removing the stigma of mental health services. So key. And lastly, the challenges that impact MS care. You can go to all of them or go back and forth. So Tyler, talk to them a little bit more about the breakout sessions.
Yeah, those are some thunderous sessions, man. These are going to be great. Again, slowing down, you'll be able to locate and select your breakout session in the program session room. All right. And when you enter the Zoom breakout, keep your virtual environment browser open. That big square you're looking at right now, that big square, leave it open. When your breakout session ends, you can simply hit the X, top right-hand corner, out of the Zoom window. Just hit that X to return to the summit. All right, where we are, and access the final set of breakouts from the program sessions. Just tap that X and it will bring you back. Okay, that's all we got to do. Before we go, we have a special message to the community from Dr. Bertice Berry. Oh man, it's gonna be fire, Michelle.
She is awesome.
Yes.
So some of you may recognize Dr. Berry from her nationally syndicated talk show called The Bertice Berry Show, or from one of her other numerous TV experiences. She also shares a daily inspiration video on her social media platform, and she has graciously allowed us to share a video with you today about her own experiences living with MS. So here you go, Tyler. Let's bring her in.
No, listen, we hope you enjoy this inspirational message. Michelle has been great, and we will see you all back here tomorrow at 1 p.m. Eastern time. Let's go so we can grow. Michelle, it's been a pleasure.
Yes. See you tomorrow, all of you. Enjoy the rest of the conference.
Hi, I'm Dr. Pertice Berry, and I want to tell you a story. Prior to the pandemic and telling these stories for what I thought was 5 people who really needed to hear it, I rarely told people that I have MS. Someone said that I shouldn't say that I have it, that I should say that I struggle with it. But I don't struggle with it. I have it, and I'm healed of it. I'm just in recovery. Anyway, prior to that time, I rarely talked about it. But I do believe when you tell a better story, you live a better life. There's something about being vulnerable in story that enables you to be true to who you really are. And that is a part of my life. And I was working with a group, and I mentioned it last night, which I don't do. But I also rarely work late. Truth of the matter is, I get up super, super early because those are my best hours, my best functioning hours. And I sleep a lot. And whenever I mention it, there is at least 20% of the room who either knows someone or is struggling with it themselves. And most of those people never talk about it. And last night I was gifted with the stories of those who don't talk about it. And one man told me that it affects his memory and that he forgets things, and people tease him and just think that, he's just having one of those days or whatever, but they have no idea that he has MS. And he said, I'm going to let people know, because if they know, they'll realize why I'm struggling. And they'll realize that as good as I am, as amazing as I am at doing my job, it is hard to do. And I keep this to myself because I don't want anybody to think I'm different, that I'm not capable, that I'm not able. And I said, that's what I was doing. And he said, I get it now. When you're true to yourself, you can be true to others. And I was like, yeah. Then somebody else came up and said, I have severe vertigo. I'm falling all the time, and people just think I'm clumsy. And he said, now I'm going to tell him what's going on. It'll be a good thing for me to tell him what's going on. Somebody else came and told me about how their daughter was just diagnosed, and they were afraid and constantly hovering over her because it's his baby, and he didn't want to see anything happen to her. And he said, now I know I can step back a little bit and let her live her life. Somebody else came and said, can I hug you? My father just died from complications of MS. And I said, and I may too. So when I get there, if I do, I'll tell him you're doing just fine. She cried and laughed and hugged me. Sometimes the thing that we struggle with is the thing that somebody else needs your struggle for. I love you, babies. Don't let what you have keep you from being who you are, because it's a part of it. When I limp up and down the steps, it's just God saying, slow down. There's something good to see. I love you.